Good day. I'm Dr. Nokukhanya Ngcobo. I'm a specialist psychiatrist and honorary lecturer from South Africa. And today we'll be discussing the solutions needed to improve dementia standard of care in LMICs and in the African region, and particularly focusing on South Africa. So with the challenges that are present, the solutions needed would be national dementia strategy development. So a lot of LMICs or countries in the African regions do not have national dementia strategies, which then speaks to low provision or poor provision of services for patients with dementia and their families. So what's needed is an integrated dementia policy, and this would then lead to increased preparedness and service provision for people with dementia. We know from the estimates and from the prevalence data that the prevalence of dementia is going to increase and in the coming years. So if services are not ready, it would then speak to an increase in patients, but even worse provision of services. So this would be needed. And a dementia strategy would give clear care pathways, and then obviously would also speak to adequate protection of people with dementia from abuse and neglect, and also speak to caregivers, so improve family support and care provision for them. We need research prioritization. So prioritize research funding and prioritize research in dementia, because in a lot of the LMICs, prevalence data is lacking. So if prevalence data is lacking, it then becomes difficult to plan. It becomes difficult to also develop policy, but also becomes difficult to look at the needs and the phenotype of dementia in that population in order to provide person-centered and patient-centered care. There also needs to be improved healthcare worker training. So training and skills development for healthcare workers, especially at the primary healthcare setting, because we know that studies have shown that doctors or physicians in a primary healthcare setting do not feel confident and feel that they do not know enough about dementia. So improving their knowledge will help with early diagnosis and will help with the improved diagnosis of patients with dementia. And these patients can then access services and get an improved quality of life. And then also career advancement in professionals. So increasing numbers of geriatrician and older age psychiatrists. So increasing number of specialists to be able to cater for the older population that is expected to increase. There also needs to be a lot of advocacy and destigmatization and increased awareness. It's unfortunate that so many years later and in this day and age, there's still people that get killed because of dementia symptoms being attributed to things like witchcraft. So we need advocacy for people with dementia and education at all levels, including communities. So education about dementia, increasing awareness, and increasing dementia-friendly societies so that people with dementia and their families feel safe to be in the community, feel safe to access services without the stigma around it. But also to strengthen the voices of the people living with dementia so that they can also be part of their care provision and part of their care delivery. We also need health promotion because we know that with dementia, there are some modifiable risk factors. So publicizing risk associations is good so that there's modification and there's health promotion and there's health support, so that people know about dementia and know what they should be doing to help prevent or help mitigate their risk of getting dementia. In another way that we could look at a solution, we know that in some African regions and in South Africa per se, a lot of patients or a lot of people still use or practice traditional health practice. And there are many more traditional healthcare practitioners than there are medical specialists. Certain conditions, such as HIV and TB, have looked at collaborating and working with the traditional healthcare practitioners in treatment of these conditions with good benefits. So it would be good to collaborate and understand the practices of traditional healthcare practitioners, and collaborations would also enhance the cultural acceptability of dementia and also look at their practices and their understandings in order to find solutions that would be more culturally appropriate. The other thing also would be looking at the improved use or improved dementia screening tools, which are culturally appropriate and culture fair and culture sensitive, and not just a translation, so that we could also then be able to diagnose more patients and allow more patients to get a diagnosis and get treatment and get care. So in conclusion, just looking at the projected number of people with dementia that is expected to rise, but also looking at currently the number of people with dementia, it's important for LMICs and the African region to prioritize dementia care and to prioritize dementia service provision to improve the quality of life of not just the people with dementia, but also their caregivers and also their communities. Thank you.